Welcome to episode 2 of the video blog series presented by the Global Health Division. My name is Krista Wark, and today I'm sitting down with Andrea Mendoza to discuss her global health work in rural India.
My name is Andrea Mendoza. I am a pediatric physiotherapist here in Vancouver. I've been working here for 5 years at a private clinic, and I have been to India twice before on volunteer trips, and I just finished my recent trip there.
On this recent trip to India, you were the recipient of the Global Health Division's clinician bursary. Can you tell us a little bit about your project and what you were hoping to achieve there?
Samarthya is the name of the organization. It's an NGO located in a very, small town of Koppal, which is actually about 60,000 people. Their mission is to work with and empower individuals with disabilities and their families. And that ranges from birth up to adulthood. So mainly they work with children who have disabilities and also adults who have spinal cord injury. So in my previous trips there, our role was mainly in a clinical role, but during that time we had identified a lot of barriers that were stopping them from growing or stopping their programs from becoming even stronger. So this trip was focused on trying to develop the sustainability and strengthen those programs. So looking at more of the behind the scene things and focus on training versus actually going to do the clinician, the hands-on work. So I slotted 5 months to be there. I was there for the whole 5 months, but I was fortunate enough to recruit a team of 15 other volunteers, all of whom are either physiotherapists or orthotists and prosthetists, and they came for about 4 to 6 weeks each group, 4 or 5 people at a time, and they kind of cycled throughout those 5 months. We kind of looked at this project in 3 phases. So the first phase was just information gathering. So the volunteers who came at the very beginning, Julie Alexander was in pediatrics and Jen Tam was in spinal cord injury. And so they did a lot of the groundwork and kind of just understanding how the programs worked and trying to identify where those gaps were that we could try and address, what we could feasibly address. And then phase 2 was starting a lot of the planning and what are some strategies that we could employ to address these gaps. And it was a lot of preparing training manuals, looking at systems, doing a lot more research in those sorts of areas. And then phase 3 was a lot of carrying out of these new plans. So it was really neat to see these 4 groups work together, even though very few of them ever overlapped. I think our biggest achievements were that the spinal cord injury unit went from being a very small program that didn't have a lot of structure but was accepting these clients, these adult males who had spinal cord injuries who really needed the rehabilitation. It went from being a very small program to a much more efficiently run. They were able to take up to 8 clients at a given time. They would stay for a set period of time, and the volunteers worked tremendously hard on creating a huge training manual and really starting from the basics about they really taught to the level of these 2 therapists. So that was a huge win, because even from my time, because I was fortunate to be there over the 5 months, I saw these 2 staff. I saw the level that they had entered this position in back in November, and when I left, their vocabulary, their knowledge about the human body and about spinal cord and about rehabilitation had skyrocketed. And so I really think that we were able to give the gift of education to these 2 guys, and they were really young and keen, and I know that they're going to continue in this position and keep growing in their learning. We got a lot of feedback from the spinal cord injury clients that were there, and they were so happy with how the program had turned out and with the service that they received. So the other area was in the early intervention. And a lot of the volunteers came and worked specifically with the staff who worked in pediatrics, and so similarly did a lot of training. There were some new stuff that were identified. who we were trying to start to train so that when the senior staff eventually retired, or if they left or became ill or something, that we would have a junior staff that could work and continue the early intervention program. So I think we were able to train 4 new staff on the beginnings and really gather what knowledge they wanted to learn, and started also to put together a great training manual for them. And then the other area that we worked on was the workshop. So the orthotics and aids and appliances workshop. And we had a fabulous group of 4 orthotists and prosthetists who came, and they were able to do a lot of knowledge sharing back and forth, and also made really great suggestions for renovations to the workshop that would also improve safety, improve their workflow and efficiency. And so the staff who worked in the workshops were so thankful for our volunteers' input. So those, I think, were 3 of the biggest program achievements. The other major achievement that is more of a softer, like it's not such a tangible one, was that through our discussions with all of the staff, whether it was management or the actual therapists, was that everyone was opening their minds up to the concept of sustainability and thinking about the future. A lot of them had admitted that they didn't really think about what was going to happen past the next 3 years or 5 years. And then, so we started a lot of these conversations of the next generation of therapists, and really trying to direct their focus on how the programs are going to survive after their time here. And so I think I realized that change, like a full change, 180 degrees, couldn't have happened in that short period of time, as change takes a long time and we have to be patient with it. But the fact that a lot of them had opened their minds to it, I think, was also a huge success. So they're going to continue having those conversations among themselves and taking those factors into consideration when they're making decisions about where to put their money or where, like, how to change their programs. They'll be thinking a few steps ahead. So
yeah, that's amazing. And I think when you're there on a day-to-day basis, it's hard to see that those changes are happening. But those achievements that you made, that's incredible. You should be very proud of that.
Thanks.
You focused more on sustainability this time. So what was the most difficult part about getting this local organization on board with this sustainable vision?
What I found was that in theory, everyone understood sustainability. All the staff and all the senior management and also the staff and even the junior workers all understood that some changes needed to be in place. They needed to put some processes in place in order to make the organization continue on. However, what I found over those 5 months was that even though in theory they understood that changes needed to be made, the change didn't happen as quickly as we had hoped, or they would say that they would be open to change and then the change wouldn't actually happen. We put a lot of effort into trying to teach them the problem-solving process and the critical thinking, but of course this, as we learned, a lot of this stems from a very deep-rooted cultural value of rote learning and didactic learning and a very paternalistic health and education system. So that was a challenge that we encountered while we were there.
That's really interesting because it's such a deep-rooted thing. How did you feel trying to project our values on how we do things in our healthcare system? Do you think that was beneficial to them? Did you have discussions with the organization about that and how they wanted things to move forward?
So there were continuous discussions with the staff, mostly the senior staff, because they had more fluent English, and the management about, how we could which changes were feasible within their culture. And so among the volunteers, we had great discussions about this as well. We were trying to figure out which barriers were cultural, which maybe we shouldn't necessarily tackle because it was a cultural thing, and which barriers were purely an inefficiency thing, and those are the ones we could tackle. But it was really hard in the initial stages to tease out which was what things were cultural and that we should leave alone, and then which things were purely inefficiencies.
So is there anything that you wish you had more information on or more skills in certain areas before you arrived there for this project?
Absolutely. So prior to this trip, I had no other training in global health. I worked in pediatrics and was very focused on that, and had done these 2 previous volunteer trips, but never really attended any seminars or anything like that. So I think that would have been helpful, a little bit more training on how to influence change across a cultural barrier or cultural differences. So another step that I wish that I had in preparation was that I wish that I had a conversation with someone else, another physiotherapist, who had done a similar project. And I'm aware that there are so many of them out there who have spent a significant portion of time in a developing country to work on something similar as sustainability, like this focus of this project. But I found that I guess I didn't have easy access, or I didn't ask around enough to see who these people were and get in contact with them. And also I found out after my trip, or during the later stages of my trip, that there were actually global health training programs or courses that were available. But I didn't know that was possible. So in retrospect, I wish that I had a bit more training in that aspect.
Yeah, which makes sense, because then you could have been more prepared for your global health work. There are a lot of resources on the Global Health Division website, and we're always looking for ways to improve it and make it more accessible to our members. There's also a website called GoPT, and that is a website similar to a Facebook where you can go on, and it's physiotherapists who are working in global health. So we'll leave information about that in the notes at the bottom of the video.
Perfect.
You were there for a good chunk of time. 5 months is a long time to be away from home and to dedicate to a project like this. What do you think that you gained from it? What were the key takeaways for you, and how you've changed as a person and maybe a clinician?
I was reflecting soon after I arrived back in Canada about how did this trip to India and doing this global health work change me? And what I realized was that really, what areas did it not affect me in? So for example, as a physiotherapist, I myself didn't do a lot of the clinical work, but I was able to see really like the impact that we can have as physiotherapists, and how really using just our hands and our minds and our passion for helping people move and get back to movement really changed. It affected so many people positively. I also saw the power of education and how physiotherapists are so well positioned to provide education, and if we can empower our patients or our patients' families to take responsibility for their health, that's really how we can truly impact them. Additionally, from a personal growth perspective, the amount of insight that I gained into, for example, like what is our role as physiotherapists, what's our role in global health, I had so many aha moments almost on a daily basis. So I think that I really grew from that. And then additionally, just being so grateful for the amazing city and the country and the healthcare system that we live and work in. I was really changed by a lot of the people and how they interacted and accepted me into the Samuha family, and I was invited to their homes for breakfast and dinner, and I felt like I really got a chance to connect with them, and so I will forever remember this experience. Even though I know that the experience profoundly changed me, speaking to all of the volunteers that have come, all 15 of them, and anyone that I've spoken to who has been to Samuha Samarthya in the past or has done any sort of global health, the benefit and the reward that you get from doing any sort of global health work is absolutely worth the experience. And all of the volunteers said that they will forever remember their experience at Samarthya. And so I think it's absolutely worth it for anyone who's interested in global health to do some work.
So where can we find you? Where can people contact you?
If someone wanted to get in contact with me, the easiest way is through my Twitter handle, which is at physioandrea. You can either tweet me or send me a private message.
Sounds great. We will add that to the show notes. Thank you so much for sitting down with us today and taking the time to give us some more information about your project. It sounded amazing.
Of course. Thanks so much for having me. And also thank you to the Global Health Division for the bursary, which certainly made it more feasible for me to go on this trip.